As we've discussed, I think a nasal steroid spray is the best medication to control your allergies at this point. These do contain steroids, and you may have heard of various side effects associated with steroids, but all of these occur when you take steroids by mouth over a period of months or years. You swallow them, absorb them from the stomach, and build up a blood level of the steroid so that all of the organ systems in the body get exposed to it. That's how you get the side effects. The way we get around this in allergy is with these sprays, which put tiny amounts of steroids right where we need them, right into the nose. Since we don't have to dilute them out in your entire bloodstream to get them there like you do when you swallow pills into the stomach, we can use very small doses, small enough that it pretty much gets used up in the nose, so there's very little left to be absorbed. The rest of the body gets exposed to only negligible amounts of the steroid. It's kind of like having your cake and eating it too. You get all of the anti-inflammatory benefits of the steroids in the nose where you need them, without all the side effects you get when you take steroids by mouth for prolonged periods. So these sprays are safe and effective and can be used for long periods of time. The way that you use the nasal sprays is very important to maximize the effectiveness and reduce side effects. Like many liquid medications, you should shake them up very well first, but don't simply put it in your nose and squirt, because it will fly through your nose, go down your throat, taste bad, and it won't do the nose any good. To minimize that, tilt your head forward so you're looking straight down at the floor and point the sprayer up at the ceiling. That directs the spray up into a honeycomb of little bones in the nose, so the medication lands on them rather than just flying on through. Put the sprayer all the way into the nose, straight in, or a little out to the side, like at your eyeball. Don't tip it toward the nasal septum, which is the bone in the middle of the nose. If you keep hitting the septum at point-blank range, it can get irritated and start to bleed a little bit. When you blow your nose, if you see some flecks of blood in there, that's what it's coming from. Look in the mirror when you're using the spray to make sure you're aiming off to the side. You should also hold your breath while you squirt. If you're inhaling while the drug is airborne, you'll just suck it down in your lungs. It's not going to hurt the lungs, so don't have to worry about that, but it's not doing the nose a whole lot of good down there. So hold your breath when you squirt, and after it lands in the nose, you can sniff to kind of drag it up a little farther. To review, shake up the sprayer really well first. Tip your head forward, looking at the floor, and point the sprayer up at the ceiling. Look at your toes when you spray in the nose. Close off the other nostril. Put the sprayer all the way into the nose, straight in or a little out to the side, then hold your breath and squirt. After it lands in the nose, you sniff to drag it up a little farther.